Hey there, this is Erin Lundy. I am a physical therapist with Milestone Therapy, Inc., and I'm located in the Charlotte, North Carolina branch. And today I want to talk to parents about joint hypermobility syndrome because this is a huge percent of my caseload, and I have so many parents that are really concerned when we start talking about that, like asking me big questions like, oh, is it causing them pain? Are they going to have a tough time competing in sports later in life? And those are all great questions, and I want to make sure that we're addressing it. So first off, joint hypermobility syndrome, as you think about a joint, so two bones connected, as extending beyond where the typical range is. So they're double jointed basically. And it's not necessarily a bad thing, but when you see it occurring all over their body, like they're really, really flexible and they can contort themselves in all these different, ways, then they probably have kind of a gross overall big picture syndrome that needs to be addressed with their connective tissue. So they're out the way that their bones are connected, and it's an inherited disorder. So, which means that it's passed down from their parents. So a lot of times when I tell parents like, hey, I've identified that your child has joint hypermobility syndrome. Does anybody in your family have any history of like being a ballerina or a gymnast? And they're like, oh yes, as a matter of fact, I'm really flexible. It's like, well, there you go. So first of all, it's super common, like I said. A couple studies, actually there have been a lot of studies about this specific condition. And one study found that 34% of school-age children have this. So, big percentage. And another study I've read said that kids that have this condition also happen to be 2 times more likely to have musculoskeletal pain, which means like pain in their muscles, pains in their joints, things like that. Because a lot of times when you have a really flexible joint, that means there's not a lot of stability around it. So not to worry, there are things we can do about it. As you can imagine, that if your child's joints are really, really flexible and they're able to move a lot without a lot of stability around their joints, there could also be some implications with like you're noticing that they're really clumsy, their feet are really flat and their arches fall in, their walking pattern, their running pattern looks a little bit different. And I also hear parents say a lot of times like, oh, my kid just like flops down on the floor. Like it seems like they don't really have like a lot of control when they're running downhill, like things like that. And that's totally normal. And that's totally stuff that we can totally address with physical therapy. One of the ways that your physical therapist or medical provider can screen your child for this condition is called the Beighton Scale. So it is an objective measure where we examine different body parts just to see if there's hypermobility all over their body, basically. And they scale on a score where you get 9 points total. And if your child scores a 5 or above, based on how hypermobile that they are, then they're considered hypermobile. So I'm gonna use my little demo doll here, and he's gonna help me show you what your physical therapist is gonna have your child run through, and something that if you even wanna take a look yourself. So first off, they're gonna be examining the spine, and also the hamstrings, basically the whole back of their body. So they're gonna have the child reach forward to touch their toes and have their hands completely flat on the floor, and if they can touch the floor with their knees straight and everything, then that's going to count as 1 point. Next thing that they're going to be looking at is their elbow. So what you're going to have is they're going to have your child try to extend their elbows as straight as they can, and if it extends beyond 10 degrees past kind of where the normal range is typically, then that's going to count as a point. And you get 2 points if you have both elbows that extend. The third criteria is looking at their fingers. So they're going to ask your child to hold their palm out straight, and they're going to just passively move their pinky all the way back. Now, if their pinky can go all the way to 90 degrees, then that's considered a point as well. So you get 1 point for each pinky. Next body region that your physical therapist is going to be checking for is your child's knees, and they want to see if they can straighten them beyond 10 degrees. So if this is 0 and your child can extend beyond 10 degrees, then that is also considered a positive. And so you get 1 point for each knee. The last area your therapist is going to be examining is the thumb. So they're going to have your child place their palm flat on the table with palm facing up. And they're going to take your thumb and bring it all the way back to your forearm. And if it touches their forearm, which usually freaks parents out, then that's going to be considered a positive 1 point. So they get 1 point for each thumb that touches their forearm. The last area your therapist is going to be examining is the thumb. So they're going to have your child place their palm flat on the table with palm facing up. and they're going to take your thumb and bring it all the way back to your forearm. And if it touches their forearm, which usually freaks parents out, then that's going to be considered a positive 1 point. So they get 1 point for each thumb that touches their forearm. So if your child does score a 5 or greater on that 9-point Beighton scale, what your physical therapist might recommend is a referral onto a geneticist. So if they want to objectively know more information about if your child definitively has this connective tissue issue, then that's something that you can look at a little bit more. There are some implications of sometimes if the connective tissue in their joints is a little bit more loosey-goosey, then sometimes that can also affect like the connective tissue in your heart, because like the things that open and close the valves are connective tissue. So that's just something to consider if you wanted to examine it a little bit more and make sure you're monitoring. Another consideration, again, worst case scenarios here are if your child has more laxity in their joints, then they're going to be at increased risk for dislocating their joints. Meaning primarily I've seen a lot of hips. It's called hip dysplasia, meaning that the leg bone that attaches inside the hip is not as deep, and it can sometimes be a little bit more shallow, and it can click and pop and be a little bit painful. So again, something else to be mindful of, and I'll definitely show you some tips and tricks for how to try to avoid risking any type of subluxation for that. 3 stretches that I would recommend that are really integral to trying to help promote a ton of hip health and reducing risk of your child's hip dislocating or subluxing more is, first of all, you want to do a hamstring stretch. So back against the wall, feet straight, toes up, and even just sitting here without me even reaching forward, I can feel a perfect stretch down my hamstrings. Now, granted, mine are very tight, so that is something to consider too. But if their toes are up, that means it's an increased stretch. You can also stretch their heel cord by having them stand against the wall and have their foot up against the wall and holding it here with their heel cord being stretched back here. Now, third stretch that I'd recommend is helping your child's hips try to avoid movements like this, and you want to have them stretch this way. So a lot of times you can have them sit, and it's called a figure 4 stretch. You cross one leg over and you can hold it here, and you can feel a really good stretch on the side of their hips that help control that motion, so that way it forces them a little bit more into that natural motion rather than trying to pull it away, which can increase your risk for dislocating your hip. 2 other different muscle groups you can try to address to strengthen kind of around the whole hip area. You can work on what we call the adductors, so the insides of their thighs. You can take a pillow or a playground ball or a towel roll and tell them to put it between their legs and squeeze, squeeze, squeeze. And so I've got both my legs squeezing together, holding for 5 seconds, and you can make it like a really fun game. You can have, like fun music playing while they're doing this, and, celebrating when they get their 5-second holds. Another one, I like to call them mini wall squats. So I'm sure you guys remember these from gym class. So back stabilized against the wall, bend your knees slightly and go down and back up. And you can keep their back flat against the wall, but it's really targeting their quadricep muscles. So they're muscles that help control their knees from not bending too far forward. It also helps control their hips a little bit more, so that way their core is nice and stable. Those are just some sample exercises that your therapist might recommend, just depending on what your child's specific needs are. So let's say that your child's back muscles are a little bit more slouched and they need to work on their posture, their core, different things like that. Crab walking. So you have their hands on the floor, bottom up in the air, and they can crab walk forwards and backwards. You can have them have little goal lines. You can draw chalk in the driveway or wherever, and then have them try to race their friends, make it really fun. Again, just some more sample exercises about what your physical therapist might recommend. Well, I hope my demo doll and I were able to help answer some questions for concerned parents about what it is going on with their child's connective tissue. Should they be concerned about it? Just some different exercises that we've gone over that your physical therapist might recommend, some different techniques for correcting the way that your child sits, and also hopefully help you maybe identify that, hey, my child might need a physical therapy referral to try to help strengthen all these muscles. Because what's really cool is that as your child grows and as their muscles get stronger, it's like they're able to achieve so much and be able to do so much. So I hope that I've assuaged some concerns and helped really resolve a lot of questions that you've had. If you have any other questions, I would also recommend looking at Cincinnati Children's Hospital has joint hypermobility guidelines, and they're really well written. They break it down beautifully for parents. They have lots of pictures, lots of explanations, tons of evidence-based research that they've cited, that they've put together. So if I had any more questions, I would check it out there. Hope you guys have the best of luck. Thank you.